Hello and namaste. I am Dr. Alisha Manandhar and I'm delighted to welcome you all to today's session. The Community Medicine Capsule series is designed not just for MDMS appearing students, but also for undergraduates and MD community medicine residents. In today's session, we'll explore female community health volunteers who are the vital link between the healthcare and the community. By the end of this session, I hope you'll have a deeper understanding of the importance of FCHVs in the community and also be well prepared to answer relevant questions in your exams with a well-rounded perspective. Let's begin our journey into understanding how the selfless work of these community volunteers are shaping the future of public health in Nepal. Let's start with our session today. So who are FCHVs? First of all, what is FCHVs? FCHVs is an acronym for Female Community Health Volunteers. So as you can see in the slide here, FCHVs are local women who functions as a bridge between the government and the community. Okay, so coming to the FCHV program, in the year 2045-46, as we can see here in the slide, Government of Nepal initiated the FCHV program across 27 districts initially and eventually expanded to reach its, initially expanding its reach to encompass all 77 districts. Initially, a single FCHV was appointed per ward with a subsequent shift to a population-based approach, which was introduced in 28 districts in 2050 PS. The goal was to improve the health of local community people. So the main goal here is, as you can see in the slide, to improve the health of local community people by promoting public health. It includes imparting knowledge and skills for empowering women, increasing awareness of health-related issues, and involving local institutions in promoting healthcare. So some probable questions that may be asked in our exams, I have used this symbol, that is Q. So this question may be asked in your exam, so I have kept it here. Moving on to our next slide. So what are the objectives of the FCHV program? The first one being to mobilize a pool of motivated volunteers to connect to health programs with communities and to provide community-based health services. Second one being to activate women to tackle common public health problems. We have to empower the women to tackle common community health problems by imparting relevant knowledge and skills. Third one being increasing community participation in improving health. Fourth one being to develop FCHVs as health motivators. And the fifth one being to increase the demand of healthcare services among community people. So these are the few objectives that I have listed out here of the FCHV program. So coming to the FCHV training. So before the FCHVs are mobilized in the community to do their relevant works, they are first given certain training, that is FCHV training. So initially, FCHVs underwent an 18-day training, as I have shown here. Initially, they were given 18 days training, 9 days of basic and 9 days of refresher training. But later, however, starting from fiscal year 77-78, that is starting from fiscal year 77-78, the training package was again revised to include 10 days of basic training and 4 days of refresher training every 4 years. So as shown in the picture here, FCHV training has now been revised into 14 days, that is basic training of 10 days and refresher of 4 days. So following their training, FCHVs receive certain essential resources to carry out their task in the community, such as they are given medicine kit boxes as shown in the picture here, manuals and flip charts as shown here, ward registers, IEC materials, that is information, education and communication materials, FCHV bags, signboards and identity cards. as I have shown here in the slide. Coming to our next slide. So, what are FCHVs? What can FCHVs actually do? They are not entitled to do everything related to healthcare in the community, but they have been entitled to do certain works which the government has assigned them. That is, they can distribute family planning devices, which is limited to regular pills and contraceptive pills, and they can also distribute condoms. Along with, they can also distribute iron tablets, vitamin A capsules, and oral rehydration solution, which is supplied to health facilities. So, coming to the FCHV logo and its importance, I'm sure we all have seen this logo once or twice, maybe in the community when the FCHVs were there providing services to the community people. So this logo is actually seen in the, this is actually the FCHV sari, in which the border of FCHV sari looks like this. So the sky blue border with 4 circles in it as per the logo of FCHV. So as we can see here, in the border part of the female sari that the female community health volunteers wear, there are 4 circles imprinted in the sky blue border. So does this have any significance? Of course, it has certain significance. So let's see what it is. So it means when a small pebble is thrown into a pond, it creates a wave which gradually spreads all over the surface of the pond. Similarly, the activities of FCHVs start at ward level and gradually spreads to VDC level. So the circles are actually trying to show that when a small pebble is thrown in the pond, a wave is created. So that kind of wave is shown by the circle, that these kind of circles that the FCHV sari has. So it's like a small pebble when thrown in water, it creates certain waves. So it is trying to show that. So similarly, the activities of FCHVs is also depicted like that. And subsequently, the district will be covered with such actions, and ultimately, whole nation will be developed through FCHVs actions. So the innermost circle, so this one, the innermost circle, shows that the action starts at the community or ward level by individual FCHVs, as community is the center of health activities. So secondmost circle, it shows the action is spread in the entire VDC. The first one was in the ward level and then to the entire VDC. And the third circle depicts whole district, which will be covered by FCHV's action. And the outermost circle, this one, it shows that the action of FCHV will cover the whole nation. So this is the significance of, the FCHV sari. So how are FCHVs selected? Can anyone interested become FCHV? No, not at all. So there are certain criteria which we need to abide by to appoint someone as FCHV. So what is it? A meeting of mothers group of health will select FCHV on the following basis. So the decision of the selection of new FCHV will be communicated formally to local health institution and also the local government. So what is the basis of FCHV selection? This may be another probable question in your exams. So what is the basis of selection of FCHV? So first one is she should be the permanent resident of the related ward of VDC. She should be interested to work as FCHV for at least 10 years. The age should be between 25 to 45 years. And she can be either married or single. And she must be having commitment to serve the community. And the priority will be given to those who can read and write so that the work can be efficiently carried out. So the priority will also be given to women from Dalit, Janajati and marginalized groups. And those who are interested to be FCHV will have to submit an application to Mothers Group for Health. However, those women who are involved in a paid job will not be allowed to be work as FCHV because this is entirely a voluntary work. So someone who is already involved in certain paid jobs, she may not be able to contribute her full time. So because of that purpose, another criteria or selection criteria kept is women who are involved in a paid job will not be allowed to become FCHV. The population ratio for an expanded population-based program will be as follows. That is, according to the geographical region of Nepal, in Tarai, 1 FCHV per 1,000 population. For Tarai, 1 FCHV per 1,000 population. For hills, 1 FCHV per 350 population. And for high mountains, 1 FCHV per 200 population. So this can also be another question that may be asked in your exams. So what is the primary role of FCHVs? So what roles do the FCHVs actually play? The first one being to advocate for mothers and community members. And the second is being promoting healthy behaviors related to safe motherhood, child health, family planning, and other community-based health issues and services. As of 2079-80, around 51,423 FCHVs are actively contributing to healthcare in Nepal, with approximately 174 FCHVs per 1 lakh population, as we can see in the slide. So I have taken a chart from the annual health report of Nepal. Here, this chart shows the number of FCHVs per 1 lakh population. As we can see in the bar graph here, the maximum number is in this column, that is, this is for Karnali province. So in Karnali province, there are around 250 plus FCHVs per 1 lakh population, and the least being, I think, this is in the Madhya province. Okay, so coming to our next slide, FCHV's role is, it is highly acknowledged by the government of Nepal in achieving milestones of Millennium Development Goals and SDGs. Government has also praised FCHVs that their work is actually contributing to achieving milestones related to Millennium Development Goals and Sustainable Development Goals. They are also recognized for having played a major role in reducing maternal and child mortality and morbidity and general fertility through community-based health programs. So FCHVs are actually contributing to a lot of important programs in Nepal and decreasing their morbidity and mortality related to maternal and child health, and through reducing the general fertility rate as well, and achieving certain important indicators such as Sustainable Development Goals and Millennium Development Goals. So the latest amendment of FCHV strategy done in 2076 highlights the context-specific revisions such as change in FCHV selection criteria and institutional arrangement to support the FCHV program in order to encourage them to do their works more efficiently. So what are the facilities that the FCHVs get? So in the slide we can see here, Nepali rupees 10,000 is allocated to each FCHV as a dress allowance every year. Travel allowance of Nepali rupees 12,000 is provided to each FCHV as transportation cost every year. Since 2071-72, that is since 2071-72, government has allocated a budget of Nepali rupees of 20,000 to each FCHV as an appreciation for their contribution during the farewell to FCHVs over 60 years of age, as recommended by Health Mothers Group. And International World Volunteer Day is celebrated on 5th December, which is celebrated as Female Community Health Volunteers. So this can be another probable question, that is 5th December is celebrated as Female Community Health Volunteers Day. Government of Nepal bears 50% of the premium of health insurance for individual FCHVs. This is again next important. This is again one important. Decision that the government has made. That is, Government of Nepal bears 50% of the premium of health insurance. That is, if any FCHV wants to do the health insurance, then the premium will be borne by government. That is 50% of the premium will be borne by the government. And also they are one of the target groups to receive services through social service unit of health facilities. So this is another encouraging aspects for FCHVs. Let's come to major activities in fiscal year 79-80. So coming to the major activities in fiscal year 79-80, the first one is being programmatic activities. I would like to remind you that all this information I have taken is from Annual Health Report of Nepal 2079-80. So if you have any confusion or you want any more clarification, you can refer to Annual Health Report of Nepal 2079-80, which is freely available online as well. So coming to the programmatic activities, audiovisual aids or telefilms including FCHV role and health awareness produced and telecasted through Nepal television. It also conduction of orientation and mobilization of FCHVs for national health programs has been conducted. FCHV review meeting is also held at the province level and local level, and FCHV Day was celebrated on 5th December at national, provincial and every local level. Along with that, dress allowance, appreciation amount during farewell and travel allowance has also been distributed in previous year, which is among the programmatic activities done for FCHVs in fiscal year 2079-80. Coming to the FCHV's contributions to health service delivery, which is again one of the activities done in fiscal year 2079-80, that is distribution of family planning commodities, that is refill pills and distributed. FCHVs have distributed condoms as well among the family planning commodities. FCHVs has also conducted mothers' health group meetings. Even though the government of Nepal has policy of mandatory institutional deliveries, pregnant women still cannot reach health centers for delivery due to various reasons. Because of certain geographical constraints and difficulties, women are still seeking deliveries at home. So for this purpose also, FCHVs are helping them a lot. That is, their FCHVs are supporting mothers and newborns, newborn care during home deliveries, as well as they have also been helping them by visiting during postnatal period. In the first week of delivery, FCHVs provide care and health counseling to postpartum mothers on areas such as breastfeeding, care of mothers and newborn, in identifying danger signs of mothers and newborn, and encouraging them for postpartum visits to institutions as per national protocol. FCHVs have also been providing support to postpartum mothers in initiating breastfeeding within 1 hour of birth and immediately providing vitamin A capsules. FCHVs also play a crucial role in reducing malnutrition among children and women of reproductive health group. So FCHVs have also been contributing in reducing the malnutrition rate in Nepal. And to assess the acute malnutrition status of the under 5 years children by measuring the mid-upper arm circumference and referring them for further management according to the severity. This is also one important aspect that the FCHVs have been carried out in Nepal, which need actually appreciation, a lot of appreciation. So coming to our next slide, I have tried to show here the FCHV's key service delivery indicators. So Mothers' Health Group meetings conducted by FCHVs in 2079-80. So in this figure, it is trying to show the Mothers' Health Group meetings conducted by FCHVs in fiscal year 2079-80. As you can see here, it has raised from 49 year to 56. So there has been a lot of improvement since 2077 to 79-80. If you see, it has increased from 49 to 56, which is actually commendable. So the next service delivery indicators, we can see the family planning commodity iron tablet distribution and the meetings held by FCHVs in 2077, 78 to 79-80. So we can see here in the chart. However, this data has decreased a bit, because the reason may be because of more access to the healthcare services that people are getting themselves from the health facilities. So they are not actually taking much from FCHVs, maybe because of the awareness reasons and various other reasons that women or people are seeking these services directly from the healthcare and not from FCHVs. So continuation of home visits done by FCHVs focused on mothers who had delivered at home due to reasons of not being able to access to health facilities. So some important works again done by FCHVs, as I have previously discussed also, is FCHVs have been continuing the home visits for mothers and newborns who have delivered at home because of various reasons, who could not go for institutional delivery. They have been supporting mothers and such newborns at home itself. FCHVs ensured that misoprostol tablets were taken to reduce postpartum hemorrhage, initiated skin-to-skin contact to reduce hypothermia, and supported the application of chlorhexidine to reduce the umbilical cord infections. FCHVs also ensured postnatal visits for review and counseling on postnatal and newborn danger signs, and supported mothers in breastfeeding. In fiscal year 2079-80, FCHVs have helped more than 50,000 mothers and newborns to initiate breastfeeding within 1 hour of birth, and distributed postnatal vitamin A capsules to postpartum mothers to more than 90,000 postnatal mothers. So let's quickly revise what are the important works done by FCHVs, that is continuation of home visits who had delivered at home, for mothers who had delivered at home, ensured that the misoprostol tablets were taken to reduce postpartum hemorrhage, initiated skin-to-skin contact to reduce hypothermia, and supported the application of chlorhexidine ointment to reduce the umbilical infections. They also ensured postnatal visits are done regularly and for review and counseling on postnatal and newborn danger signs, and also supported in breastfeeding for the females, women who have recently delivered, and also helped mothers and newborns to initiate breastfeeding within 1 hour of birth, and distributed postnatal vitamin A capsules to postpartum mothers. So this slide shows the support provided by FCHVs during home deliveries and postnatal visits for home deliveries. So I have taken this chart again from Annual Health Report of Nepal. So looking into the slide here, coming to the slide here, support provided during delivery and during postnatal visits for home deliveries. It is divided into two parts. So coming to the support provided during deliveries, coming to the initiating in the area of initiating skin-to-skin contact after birth, as we can see in the table here, the maximum support is provided in Madhya province, that is around 24,000 have been benefited here in Madhya province, highest being in Madhya province and the lowest in Gandaki province, with national data of around 40,000 beneficiaries in case of beneficiaries who have received support in providing or initiating skin-to-skin contact is around 40,000 at national level, and maximum in Madhya and least in Gandaki province. Coming again to the support provided in chlorhexidine application on umbilicus, the national data shows it is around 30,000 beneficiaries, with the maximum again in Madhya province, that is around 70,000, and the least being in Gandaki province. The probable reason why Madhya province is receiving more support is maybe because of more geographically accessibility and easy to provide more healthcare services there because of the geographical reason. It may be one reason. So coming to the next aspect of support provided in ensuring misoprostol tablets are taken is the national data of around 6,000 beneficiaries, with the maximum being in the Kosi province and minimum in Sudur Paschim. Now coming to our next part, that is postnatal visits for home deliveries. Regarding the support provided in postnatal visits in home deliveries, support provided in less than 24 hours of birth, the national average is around 33,000 beneficiaries, with the maximum in I think it's in 20,000, around 20,000 in Madhya province. Coming to the postnatal visits for home deliveries, support provided by FCHVs on third day of birth. If we see in the slide, then the national average is around 40,000 beneficiaries, and maximum being in Madhya province, and the least we can see in Gandaki province, that is around 1,025 beneficiaries. Coming to the support provided in home deliveries, during postnatal visits for home deliveries on 7th day of birth, the maximum at national average, the beneficiaries are around 41,000 beneficiaries have been benefited from postnatal visits for home deliveries on 7th day of birth, and the maximum beneficiaries again seen in Madhya province, and the least is seen here in Sudur Paschim. Okay, so this is the data that is shown in our annual report. You can also refer to annual report of Nepal if you want more details on this. Now coming to our next slide, we can see here the FCHV's support in initiating breastfeeding within an hour of birth and distribution of vitamin A capsules postpartum in the year 2079-80. We can see the data here province-wise. So let's see here. The national data is around 51,000 beneficiaries have been benefited with the support provided by FCHVs within in breastfeeding within 1 hour of birth. The maximum beneficiaries seen in Madhya province, that is maximum number of people have been benefited in Madhya province, followed by Kosi province, and then the least is in Bagmati. The least is seen in Gandaki province. So coming to our next indicator, that is distribution of postpartum vitamin A capsules in the year 2079-80, which is done by FCHVs, is the national average of around 93,000 beneficiaries have been benefited in this aspect, with the maximum beneficiaries seen in Madhya province. Maximum people have been benefited again in the Madhya province, least one being in the Karnali province. So the least number of beneficiaries have been benefited in Karnali, maybe because of geographical accessibility. Coming to our next slide, in fiscal year 2079-80, FCHVs have also contributed a lot in the screening of children under 5 years of age, that is by using mid-upper arm circumference, by measuring the mid-upper arm circumference. As we all know, to find out the level of malnutrition among children, the best method is by measuring the mid-upper arm circumference. So the FCHVs have contributed in that aspect as well. So let's see, FCHVs have screened around 36 lakh children, that is around 36 lakh 23,283 children from 6 to 59 months of age to find out the level of malnutrition in them. So regarding the screening method for finding out malnutrition, we know by after measuring the mid-upper arm circumference, we can divide them into different levels, that is moderate acute malnutrition or severe acute malnutrition or normal, by using different color codes. So through MECEE measurement, they ruled out moderate acute malnutrition, that is depicted by yellow color. that is around 2.1% children were ruled out. For severe acute malnutrition, around 0.2% children were ruled out, and 119 cases with edema were screened among children. And those with severe acute malnutrition and edema, they need to be immediately referred to the oral therapeutic center or nutritional rehabilitation homes, which is done by FCHVs. After finding the children with severe acute malnutrition, they have been referred to SWOT centers for further management. I have again taken another bar graph from Annual Health Report of Nepal, which shows the provincial differences in moderate acute malnutrition, severe acute malnutrition, and children with edema identified by FCHVs in fiscal year 2079-80. So let's look into the bar graph. What is it showing us here? So as I have already told, moderate acute by using the mid-upper arm circumference screening method, that is red. Red color is for severe acute malnutrition. So by using different color codes, we are trying to show here the level of malnutrition in different provinces. By looking into the bar graph here, severe acute malnutrition is seen maximum in Madhya province. It is seen maximum in Madhya province, that is around 34%. Maximum severe acute malnutrition is noted in the Madhya province, followed by Kosi, and the least being in this part, that is in Gandaki province. So coming to our next column, that is moderate mid-upper arm circumference screening method. Yellow color is for, as we all know, for moderate acute malnutrition. So FCHVs have given this data after the screening that they have done. Moderate acute malnutrition is seen maximum in this column, that is Madhya province again, and the least is seen in Gandaki province. Coming to mid-upper arm circumference screening method and finding the edema in children. The edema is seen maximum in Madhya province again, with the least being in Bagmati province. Coming to our next column, mid-upper arm circumference screening method. This is showing the normal nutritional level in children who do not fall in any of the categories, that is, they do not fall in severe or moderate, but they are normal for their growth. The maximum is seen in this one, that is 21.2% is seen in Sudur Paschim. Okay, so this slide showed the different levels of malnutrition, that is severe acute malnutrition depicted by red color, and moderate acute malnutrition, and the level of edema in children as found out by FCHVs during screening method. So coming to the SWOT analysis of the FCHV program, that is, let's for any program we need to analyze from time to time if the program is really doing well, or if the program should be continued, or do we need to make any further changes or amendments. So coming to the SWOT analysis, as we all know, SWOT stands for strength, weakness, opportunities, and threat. So coming to the strength of the FCHV program, the FCHV program directly connects the health system to the community, and it helps in women empowerment and also helps in conduction of regular and periodic training. So these are the strength of FCHV program. So if we are conducting any kind of national programs, it has strength, weakness, opportunities, and threat, all four aspects. So these were the strength of the FCHV program that we could identify. And looking into the weakness, then we can see that there is low utilization of FCHV fund. FCHV fund could not be utilized properly. So, and there is again lack of interventions to update FCHVs with technical advancements and their personal growth. So maybe we need to make them more updated according to the new innovations and new technologies, so they can deliver their works more efficiently. So coming next to the opportunities that we see where we can still improve, that is opportunity for us to improve further, especially for the government, where they can emphasize again in certain aspects to make this program even better is by incentivizing FCHVs through different mechanisms to reduce dissatisfaction among FCHVs related to volunteerism. Because by incentivizing, if we can incentivize FCHVs more well, they will be more motivated to do their task. And by creating social platforms for network of FCHVs and encouraging exchange of knowledge. So these were the opportunities. Coming to the threat, FCHVs are not interested in farewell programs, and multiple projects or programs utilizing FCHVs as field workers can be exhaustive to them, because since FCHVs are entirely working on the voluntary purpose, so it would not be good to involve them in all and every and all program. Like, if we are involving FCHVs for all the health programs, they may be more exhaustive and they may not be able to carry out the designated specific tasks that they are asked to. So we have to think about that. And again is, of course, the sustainability of volunteerism. So volunteers, we cannot use FCHVs as volunteers for lifelong. So maybe government need to think more regarding the sustainability of the volunteerism for volunteering for FCHVs. Maybe they need to increase certain as we already said, incentivizing more well, or giving more facilities for FCHVs, so that they will be more motivated and the program would be more sustainable. So these were the different points for SWOT analysis that I just presented. So these are my references. In case you have any query regarding what I just presented right now and you want any detailed information, you can go through these references. I have kept my references as well. Thank you.